This short patient education video is produced by the Atlanta TMD Institute. The title is Temporomandibular Disorders and Sleep because they are very intertwined. Without good sleep, you can't have temporomandibular health. Without temporomandibular good health, you can't have sleep. So we've got a lot of things that integrate. The Atlanta TMD Institute was created to educate dental and medical professionals in TMD, to develop knowledge of temporomandibular disorders, and to successfully treat patients suffering with TMD. This video is part of our goal of educating and developing knowledge in temporomandibular disorders. And I personally thank you for looking at it, studying it, and learning about it. Sleep is incredibly important for human beings and animals. It wouldn't be there if it wasn't important. A human being needs sleep to permanently store memories for later recall. If you're a student and you want to remember things, you need good sleep. The body repairs itself, and you actually secrete growth hormone in the early part of your sleep in order to repair damages that occur during the day. So, a human being needs sleep to repair damage to the body that has occurred during the daytime. A human being needs sleep to be able to think clearly. You store memories during that entire time that you're sleeping, especially during REM sleep, rapid eye movement sleep. And it maintains good mental health. A way of torturing an individual is putting them into a cell, letting them go to sleep, and then as soon as the rapid eye movement occurs, moving them to another cell. That was a technique that the Russians or Soviets had used. We certainly don't want to do that to ourselves. Sleep must be incredibly important because you just think about it, you're laying there, you don't know what's going on anywhere around you, and you could be eaten. Why would the body choose to do this if it's so risky? There must be a huge return, a huge benefit. Sleep must be incredibly important because while we're asleep and unconscious, we are at a terrible risk for being eaten by predators. So again, there got to be something really important about sleep. Pain disturbs sleep. So if you hurt and you move, you have pain, and it either wakes you up or it lightens your sleep to the degree where you really never get really recuperative, regenerative, deep sleep and REM sleep. Pain disturbs sleep, and TMD patients have numerous head and neck structures that are painful when they move. So it's one of our main objectives is to get rid of this pain, and this alone will assist with sleep. As the TMD patient moves during sleeping, pain is triggered, and this pain from the movement then disturbs the normal process of sleeping. Temporomandibular disorders are associated with sleep disturbances, no question. It seems like most of our adult and kid TMD cases have sleep disturbances, and we address that on every single patient. Pain is always the first thing to be addressed, but how can we heal the body if we don't restore sleep? Some practitioners believe, dentists believe, that TMD patients are crazy, and they're not really. They're just completely disturbed because of their sleep, because of the pain, because of so many things. And you can't just think of it as one simple thing, one joint problem. It's not. So sleep disturbances must be at some point addressed in order to heal patients. Much of the relationship between TMD and sleep has to do with tongue function. So it's here we say much of the relationship between sleep disturbances and temporomandibular disorders has to do with tongue positioning during sleep and abnormal tongue functioning in TMD patients. A great many TMD patients have a scalloped tongue with numerous indentations along the side of the tongue from pressing the tongue really strongly in between the teeth in order to what? Separate the teeth, hold the teeth in place in order to protect the joints or in order to pull the throat upwards so they can breathe, because during sleep apnea, the throat will sometimes collapse backward. But we see it in TMD patients too. And what they're very often in TMD patients trying to do is pull their jaw forward or separate their jaw so the jaw joints don't push into the ears and crush the back of the temporomandibular joints. Do you ever wonder why your tongue doesn't fall back into your throat and just suffocate you? That's because the tongue is attached to the inside of the mandible, which is the lower jaw. It's a critical concept, and there's multiple muscles and tendons that hold that tongue. And when the tongue goes forward, it has to push off of the mandible or pull against the mandible. Got it? So the mandibular positioning affects where the tongue is and how it functions. If you look at the top left corner of this mandible, you'll see that it has a condyle that says articulates with the temporal bone. So that is where the temporomandibular joint is. When that jaw goes backward, it will crush the back of the jaw joint, and it will also pull the tongue backwards. Very important concept. So this is a home test that you can do. You take your pinky fingers, open wide, stick your pinky fingers in your ears, roll your pinky fingers down, push against the front of the ear, and bite down. And if you feel that mandible, the condyle, hitting into the ear, you know that that condyle, that lower jaw, is crushing all the good stuff, the nerves in the back of your jaw joint. Most temporomandibular disorder patients, they have small jaws that are pushed backward into their ears. This is abnormal. This abnormal backward position crushes the back of the temporomandibular joint. And of course, what does your body want to do? Get off of that joint, kid, and all the muscles start moving things to get off of the joint. But they can't do that all the time, so they go in a spasm, they get painful, and you have a lot of pain in your head and neck. And all the backward positioning of this jaw also moves the tongue back into the throat. So how can you breathe if you back your truck back into the kitchen? If your tongue is backward because your jaw is backward, it's going to go into your throat and you can't breathe. If you just look at almost all the oral sleep apnea appliances that we can put into patients, they bring the jaw forward and hold it there and pull the tongue forward out of the throat. That's how they work. TMD is a complex thing. We call it multi, meaning many factors, different things that are causing multifactorial disorder. There's lots of stuff that's happening with a TMD patient, and you can't think simple. You can't be simple-minded. So we do address, usually at 6 weeks, sleeping. And the first thing that we do is, on most patients, make a modified Farrah appliance. And this has a ramp, so if you look at the appliance, there's this thing sticking up. And this is actually upside down. So as you close your mouth, you hit this ramp, and it forces your lower jaw to come forward while you're sleeping. How do you like that? The modified Farrah appliance is used to reposition the lower jaw, which is the mandible, forward during sleep in order to keep the tongue out of the throat and allow the TMD patient to breathe more easily. And we call it modified because Dr. Farrah used this as his regular treatment appliance. We don't do that because it interferes with speech, and it's kind of bulky, and you smile and you can see it. So we use a lower appliance. But at nighttime, who's watching you? So we use a modified Farrah. We call it modified because we take the back down. We don't allow the back teeth to touch because there's what they call reflex biting. So we want to avoid this reflex biting, which is called bruxism. So it actually does a great job of decreasing bruxism at night, protecting the teeth, not allowing the teeth to touch so they don't grind away. And get this, it pulls the jaw forward so the tongue is out of the throat and you can breathe more easily during sleep. Many of our TMD patients, when they're wearing their regular daytime appliance, have learned to keep their jaw forward into their therapeutic bite position, and it stays forward even when they're sleeping. So we get reports of like much improved sleep from many of our patients. At about 6 weeks, we evaluate if the patient is keeping their mandible and tongue forward. We ask a little bit about sleep. First thing we do is if they're having any difficulties, we're going to be making the modified FARA that we mentioned, but we also have a handout that about 4 pages that gets into detail about what we call sleep hygiene. It's like oral hygiene is you're cleaning your teeth every day in order to maintain your teeth. And there is such a thing as sleep hygiene. These are the things that you can do to improve your sleep. And there's 4 pages. And if you just look at this, it says sleeping aids for TMD patients. I mean, the first thing is make sure that your bedroom is completely pitch dark. That should make sense because we're sleeping in caves and we don't want the predators to see us. If we're in a really dark area, the tiger's going to come in, won't be able to find us. Even though the tiger has very good nighttime vision in the back of a cave, they're not going to see us. There's no light there. So here are the bullet points of our handout. If you're interested in the handout, you can request it through our email. So first thing is make sure your bedroom's completely pitch dark. You can actually sit in the bed, stay there for about 15 minutes and see if any light leaks are there, because as your eyes accommodate, you can see the small amounts of light. Take a warm bath 1/2 hour before going to bed. You could even put Epsom salts in there that'll help you with magnesium. Prepare and take CalMag a 1/2 hour before going to bed. Go to bed at the same time every single night and wake up at the same time every morning. You'll prepare your body to learn to sleep. It's like teaching a dog. Take melatonin 1 hour prior to going to bed every night. Doesn't always work, but you do want time release. You don't want all the melatonin at once. You want it little by little over the nighttime. Do not eat anything before bed. When it's dark, we don't hunt. Humans don't hunt at night. So we don't eat at night. So don't eat at night. Never eat after dark. Do not drink coffee or any caffeinated beverages after 10 a.m. And if you're a TMD patient, it's best to stay away from it completely. Remove animals from your sleeping area. Although we have great attachments to cats and dogs, incredible attachments, sometimes we're allergenic to them. Plus, they walk around at night, they disturb our sleep. We need to be healthy to take care of them. Do not take naps during the day. Reserve your sleep at night. Exercise every single day and study your sleeping behavior. You have a bad night, go back and see what's happened the day before, right? That way, say, oh my Lord, I ate ice cream last night. Oh, I ate a late dinner last night, right? Whatever it might be, you'll see that you had a bad evening that night. I know when I eat dairy, I get into trouble, and I love dairy. I love cheese. I really do. But it's like a terrible thing. What it does to me, I can't even, if I started telling you, you'd be like disgusted. But get 8 hours of continuous sleep. Try to learn and teach your body that. If you can't get to sleep, lay there. But don't read. Don't do anything. Lay there. After a while, your body gets used to it. If nothing else works, see a trained sleep physician, not an ENT who does sleep, not a pulmonologist that does sleep, someone who went to a major university and got their training in sleep medicine, and that's all they do is sleep medicine. This course is presented by the Atlanta TMD Institute. It is for assistants. The course is entitled TMD Dentrix Notes Course, and the notes for TMD appointments are automated. They're on what we call templates, which means they're already written out, and they're customized for each patient by the dental assistant, reviewed by the doctor, and signed by the doctor to finalize the notes. But the assistant does the bulk of the customizations. This short patient education video is produced by the Atlanta TMD Institute. The title is Temporomandibular Disorders and Sleep because they are very intertwined. Without good sleep, you can't have temporomandibular health. Without temporomandibular good health, you can't have sleep. So we've got a lot of things that integrate. The Atlanta TMD Institute was created to educate dental and medical professionals in TMD, to develop knowledge of temporomandibular disorders, and to successfully treat patients suffering with TMD. This video is part of our goal of educating and developing knowledge in temporomandibular disorders. And I personally thank you for looking at it, studying it, and learning about it.